Social prescribing sounds very technical. It's not. You go to the doctor and you get a prescription for medication. Social prescribing literally is you get a prescription to come over here to the F2 and meet the social prescribing link worker, and she supports you to access, if you like, a non-medical health response, which is good for your health. And what it allows people do is they then begin to take control of their own health. So it's not in replacement of medication, it's in complement, and whatever it may be. And we started that, we got funding for it in 2016, 2017, and we engaged with the local GPs and the local mental health service, and they really started to send us prescriptions. So we would get on average between 70 and 90 prescriptions a year from people. And they come in and avail of programs. It might be counselling, it might be relaxation, the programs I mentioned before, but it also is going to the theatre and maybe finding their creative side, actually sometimes finding a job, joining the CE scheme. So social prescribing is, if you like, the social end of our lives, and to help support us in a very sort of healthy and well-being way. It's allowed people, I suppose, explore areas that they wouldn't have explored with regard to their health. It builds their own confidence. It also gets them to look at their health in quite a different way. And really, I suppose, just in terms of sort of formal evaluation, it's found right through the UK and in the Donegal pilot study is there are 20% less visits to the GP because of social prescribing. So that means that the GPs aren't as under pressure, and people are become, if you like, more interdependent on their community rather than just focused on one medical practitioner. The other thing is that depression and anxiety levels drop, and also their well-being. This is all measured by research. Well-being scores go up. So it's all very, very positive. There's nothing bad you can say about social prescribing. I suppose the only thing I will say is that while it's a growing movement in Ireland, and there's over 40 social prescribing projects right around the country, and the HSE are now backing social prescribing and beginning to roll it out very slowly. However, it's still not properly funded in the way it should be. I think in every healthcare network, that's networks of about 50,000 people right around the country, there's 96 of them. I think there should be a social prescribing service, and I think not only do you need a social prescribing service, you also need the community groups and the programs and all the interventions to support that. So we have a Fatima counselling service, which is a really good service. It's entirely run on volunteer therapists and counsellors. Some of them are qualified and some of them are students, and they give all of their time for free. So just to give you a picture, in this centre we are very imaginative, very creative, and we try and respond to the needs of the community, but we rely on a lot of connections and partnerships and people, if you like, nearly a barter system at times.
Happy Social Prescribing Day.
From Dublin 8 Social Prescribing Service.
Listen, support,
connect.
Bem-vindos.
Culture.
Like you might meet people who come in from the doctors or being suggested by the doctors, and you see them coming into groups and then gradually sort of nearly coming here every day and sort of feeling the centre is theirs and demanding, that we should be doing something else, and then going to the theatre, maybe people who've never maybe had the money or had, if you like, the opportunity. And sometimes people through bereavement, or maybe they might be single, they might not have a huge amount of friends or whatever, have, if you like, friendships and companionships, and especially to go out to the theatre, the cinema, or go to even to an art institution. It's lovely to go with somebody else, and sometimes your friends might not be interested in what you're interested in. So that's a sort of a global story. I don't think he'll mind, but one of the people here working here in the CE scheme was recently on a social prescribing meeting for Heart of Our City, which is a new partnership we've started. And he told his story, and he had gone to the LES, which is the local employment service, and they suggested he come over here and meet Adrian. And gradually through that he took up doing, I think it was cooking classes, then he's now doing Pilates, and he's now working here in the centre. So like it's often sometimes some interventions happening at the right time for the person. And what happens within other services is that there's waiting lists, obviously, and there's lots of things because of the lack of investment in our health service. So to some extent, often when people meet us, they're at the right moment that they're looking for something different and ready to change, and that can work really well. I think that's a really good dynamic.